Welcome to It's Your Case, presented by VetCity.com. I am Manuel Pinilla, your radiologist on demand for this week. Today's example is a 1.5-year-old female domestic short-haired cat presenting for a 1-month history of left hind limb lameness, which is not responding to medical management. Once you have reviewed the radiographs using your systematic approach, then you are ready to watch this video. I will highlight the most important findings on these hind limb radiographs, and we are going to start by taking a closer look at the stifles. As a quick anatomy reminder, other than the femur and the tibia, we have multiple bony structures in a normal stifle, and these are all sesamoid bones. Sesamoids are used as small independent bones that develop within tendons, providing them with a smooth surface, and that way the tendon can slide and it can transmit the forces from the muscles adequately. And in the stifle, we have multiple of them. The most evident of them all is the patella, which is also the largest sesamoid in the body. And you can see here how they are very pointy in shape, and that is a normal common feature in most cats. But the contour is perfectly smooth and well defined, and there are no signs of remodeling or any pathology on either side. We have two other sesamoids just caudal to the femoral condyles, and these are the ones that we call the fabellae, and they are within the tendons of the gastrocnemius muscles. Normally you've got a medial and a lateral one, and they can be a little bit asymmetric. And in some cats and small dogs particularly, you may notice that only one of them is present, and that is just an anatomical variant without any clinical relevance. Now, just distal to the fabellae, there is another one, and this one is within the gastrocnemius muscle tendon, and you can see it is symmetrical, it's in both sides, and it looks perfectly normal. When you look at this radiograph, you may have noticed there is the impression that there is a fifth sesamoid on this stifle, just there, just cranial to the stifle joint. Normally, we do not expect to have any other sesamoids in this area, and to be honest, I'm actually not sure where that mineral opacity is located. I look at the caudocranial views and I couldn't find it. I suspect it is intra-articular, and probably it is not a sesamoid, it's maybe just an area of calcification in the meniscus. We see this sporadically in cats, and if you look at it, it's perfectly smooth, it is symmetrical, and there is no any other evidence of joint disease, such as, for example, joint effusion or anything like this. So I would consider them an incidental anatomical variant, and I would not give it any clinical relevance. We're going to move further down the limb, and we're going to check the tarsus. Now, the tarsus is very complex anatomically. We have lots of little bones that are asymmetrical and complex in shape. But when you look at all of the bony contours of the tarsi in the left and in the right side, they all look very smooth and well defined. Now remember, radiographs are used not for bones when we do orthopedics, and you have to be very careful looking at the soft tissues. And if you have done so, you may have noticed that the common calcaneal tendon, which is here, is much thicker on the left than on the right. Okay, it's very severely thickened here. You will also see that the thickening of the soft tissues extends around the calcaneus, and there the subcutaneous tissues are much thicker on the left than on the right. And if you take another look to the bone, something that I probably overlooked before, is that there is a very subtle anomaly here. There is some almost loss of the cortical bone with a bit of an irregular opacity. So what is causing this in a young cat? My main concern would be probably direct trauma to the tendon or to the calcaneus. Maybe a penetrating injury, for example, a bite wound could also do this. Partial avulsion due to hyperextension injury, a hyperflexion injury of the tarsus. I suppose that is another option. In any case, considering there are no anomalies in any other parts of the limb and that this is very severe, I would consider that this is the explanation for the clinical signs. Regarding further investigations, I would recommend taking a very close look at the skin surface, try to identify draining sinuses, maybe signs of previous penetrating injury, and then probably follow it up with an ultrasound to determine if the tendon fibers are intact, if there is any fluid that you can sample, or any other thing like that. Be sure that you review the full report that is associated with this case. Thanks for listening, and remember, it is your case, so please post your question on the social media.